Mike, I sent you a text, but it didn't go through about the closing or putting us in the warning,
No, we didn't go in a warning,
or whatever it was.
the advisory.
I was driving down the road and I just went like that, but okay.
Well, it says warning on TV.
No, when it's storm warning.
Oh,
Yeah. All right, good morning.
Wait.
We're not sure. Oh,
is that pushing the button?
Ready? Good morning. We're not sure if Chairman, Mr. Brown will be here. He could be just running late, but we're gonna go ahead and start the meeting. If you can join me for the pledge of allegiance, please. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, February 15th, 2021, Commissioners meeting. Approve payroll claims, redevelopment, reissue early claims, and approve redemption claims. Oh, yeah, minutes. I skipped it already.
Yeah.
All right, have you read the minutes? You willing to make a motion to approve?
I sure will.
And I will second. All in favor? Aye. Motion passes to approve February 1st minutes. Oh, yeah, I gotta get my bill stuff out. Who wasn't prepared to remember me? Oh, before we go any further with the claims, I would like to, we have a meeting this afternoon at 1 o'clock with all the, for the personnel reviews. I would like to table that until the weather's better.
We don't need a motion to,
Do we need a motion for that?
Yeah, cause it's an executive session,
we'll set a date for that.
Yeah.
I'm gonna have to reschedule it, 48 hours ahead
Right.
out.
Can we do it after our next commissioners meeting? Is it the first?
That's fine.
March first.
I got most of you here. You guys okay with that? Rescheduling it today with the weather? I figured you guys would be busy. I gotta be at work at
Yeah,
12.
2 here.
Vice Chair, I would make a motion, I would move that we postpone the EDS until March first, starting at 1 p.m.
I will second that. All in favor? Aye. Alright, moving on next now to the claims. I've gone through and matched the numbers and looked through them at home on my new fancy device, and I wanna make an explanation why I don't have it today is because I gotta go to work and I don't wanna leave it in my vehicle. I don't know if it's capable of staying that cold or not without hurting it, so I left mine at home. But it is very nice. Thank you, Mr. Venture, for helping us get that. All right, Lauren, what's your pleasure?
On the claims, I will move that we approve all claims as presented.
All right, I will second that. All in favor?
Aye.
Motion passes. And give us a second to do some signing. There it is. He got here just in time,
It is.
just to sign his name.
It is up. There you go.
So, do you guys make a motion on this?
Yes, Lauren did, and I second.
Hoosier.
You had some issues, did you, sir?
Huh?
Did you have some trouble coming in?
Not a lot, just went slow.
Right. We are just now doing the conduit bill. Then I can turn the meeting over back to you.
Not for you, very much.
Yeah.
You're gonna take the refrigerator and all.
You can hold down if your card and everything. You can do that just right on there. There we
See
go.
what kind of movie they got in there for a while. I'd love to see the deals.
Yeah.
Okay. Here for the long tables. Okay, we are down to, thank you to you two guys for taking off and getting that all done for me. Cooksey Lawn Care proposals, we have Cooksey Lawn Care and CNC Enterprises.
Each one has raised their prices $5 per cutting, which is not bad since we're gonna be getting higher gas prices.
Well, we will be,
And, I'll go ahead and make a motion to approve both as presented with the new price per cutting. We got great service from them, no complaints.
yeah, that's right, they had a nice year last year. Did they bid on different ones, or?
Cooksey's still doing out there at Deer Creek, and CNC Enterprises will still be doing everything else. If they has to, they got on their prices for the Delphi Garage and the courthouse. I don't know if Keith is gonna get an assistant where he can be doing the lawn care, or would you guys prefer that we just go ahead and have someone else do the lawn care?
What do you think, Gordon?
Well, this could be per cutting, so we could eliminate this,
We will be going close over our budget.
so you can hold your budget. How much
Because,
is it?
well, we were 250, I think, with going over, so 3 cuttings of the courthouse, and we'll be over budget. So do we keep,
You can still, the courthouse is paid out of the courthouse, and the sheriff paid his too, so those are not included in yours. And you also have professional services this year that you did not have, so you can also use some of that.
I see Craig is here, are you willing to take on the courthouse every week?
Yes, we do the courthouse. I do like to say that the Delphi EMS, we move that like once a month or every other week. I mean, it don't,
It don't take much.
no.
Well, the courthouse looking good. You can figure Keith's time and lawn mowing, that's probably a pretty good deal. It frees him to do other things.
Right.
Plus the maintenance and fuel.
Well, I'll amend my motion to add these other 2 in for the courthouse and the Delphi EMS, correct?
Okay.
Second that.
Excuse me. Okay, so I have a motion and a second to accept both bids here from Cooksey Lawn Service and CNC Enterprises. And we are also adding in the courthouse lawn at $80 per cutting and Delphi EMS at $25 per cutting. You cut the other 2 EMS garages?
Yes.
Yeah, they're on there.
They're on there? Oh, yeah, it's on there, yeah.
Yeah, no complaints.
Okay, then all in favor, please say aye.
Aye.
Motion passed.
You'll have to sign one of those. Thank you.
Thank you.
Got 3 spots here for the sign.
Oh, great. We probably have to have 2 of them, one for him and one for us.
I can copy it, it doesn't matter.
Okay.
Okay.
Let's move the agenda. EMA Director Mike Fincher.
Good morning, John. Okay, the first thing I got is the 2021 outdoor warning siren annual preventive maintenance inspection. You guys have a copy of that.
Is it the federal one?
Yeah, it's the federal signal one. That's already in my budget, so it's nothing additional. I just need a signature on it. That covers the 3 sirens that's on the river.
Okay.
Those are the only 3 that the county actually owns. The other ones are either owned by the townships.
Yeah. Did we ever figure out, we did figure out they were the townships?
They're either the townships or the towns.
Okay. I'll make a motion to go ahead and approve the federal field services for the warning siren.
I'll just need Commissioner Brown's signature on one of those, so I can send that back to him.
You seconded, okay, so I have a motion and a second to endorse the Federal Field Services Outdoor Warning Siren Annual Preventative Maintenance Inspection Agreement.
Thank you.
All in favor, please say aye. Aye, motion passed.
We need 1 or 2 of these, Mike.
Just one. And then I'll make a copy for the auditor so she can have a copy of it. Thank you, sir. The second thing is I would like to start doing some quarterly training at least, within the courthouse and then expand it to other county departments, safety-related training. You should have some, there's a suspicious package and bomb threat poster. Like this right here. That's actually the card. I'll explain that in a second. We had an incident at the courthouse earlier this year of a suspicious package. Nobody really knew what to do. So that kind of comes into tie with the courthouse security stuff. Some of the other things that we would go over would be active shooter would be another training, and then some severe weather stuff, and then some other training. One would be panic buttons as well. Some people don't understand what the panic buttons are to be used for. A smaller card that you have, that's a bomb threat card. Those cards are to be placed by every phone, and when a bomb threat is received, they can jot down all that information and then they get the attention of somebody else that's working with them to call 911. When the officers arrive, they can hand that card over, and then we can make a determination on whether to evacuate the courthouse or whatever other facility it is. And I do have enough copies for every phone that is operated by the county, and probably enough for every township and one within the city. I got about 2,000 of them right now. Along with the training, of course, we'll have to do exercises. We'll build up to that as well.
I think it's a good idea.
Yeah. I remember years ago that when the Hardys out here, they got repeated bomb threats in their Hardys. Finally
That's just the courthouse employees, or are you gonna do?
We'll start with the courthouse and then we'll expand
Expand.
to, you know, the highway and other departments as well.
I think it's a good idea, I think we need to have plans on this stuff, how do we do it?
You maybe said it, and I didn't quite catch it, but, these gonna be you gonna go to each department, or are you gonna go to?
That's what I have to, at first we'll probably do like a department head, overall training, and then have an overall discussion with them. And then if the department heads or the elected officials want each one of their departments to get individual training, I can do that as well. And then, now when it does come time to start doing the tabletop exercises and the functional exercise, you know, we'll have to figure out a time to do it, cause I don't wanna shut down the courthouse to do an exercise, so it'd have to be like a Wednesday afternoon or something like that. So there may be some comp time that would have to be given, but, you know, that's a little ways down the ways, that's just something that we need to start thinking about though.
Right.
So you've made the motion to do it?
Yes, sir.
I think it's a good idea, so teaches people, refreshes us and refreshes. The changes made in, like say, the panic button, people like that. Review that. Second.
Okay, so I have a motion and a second to, further this training. All in favor, say aye. Aye. Motion passed.
Thank you. The third thing I got is, Keith and I have been working on the panic buttons, due to some issues that had happened earlier this year as well. People didn't know what they're actually used for and when to activate them or where they're even at. I don't wanna get into further detail of where they're at and that because it's a security thing. We got all the firmware updated on them, so we know that they're working properly, but we are short some. When we went through, we're short about 11 of what we actually need. With the reimbursement that we got through the CARES Act, and since we used it for salary, we do have some money that's left. We can actually use, since it was reimbursed for salary, we can pretty much, the county can use that money for whatever we deem necessary. The cost of these buttons are about $125 a piece.
It's installed, ready to go, right?
They're just, we order them, we put the battery in them, and then we attach them to the system.
They're not wired or anything like that?
No, they're wireless. They do attach, they're wireless to a radio that's down in the basement, and there's some repeaters throughout the building that attach them to that radio. That broadcasts it over the airwaves, and it also goes to dispatch.
And use 11 will make our contract go up, stay the same.
Yeah.
Safety issue.
And that radio in the basement will pick up to the third floor?
With the repeaters that we have.
I'm gonna make the motion to add the extra 11 buttons, panic button. If we're doing this training, we might as well have the safety to go with it.
Yeah, put that, you know, more than it costs. I'm trying to use it to do. I'll second that. City's motion.
Excuse me, I've got a motion and a second, to buy 11 more of the buttons. All in favor, please say aye. Aye, motion passed.
And then the last thing, we have 2 more reimbursements, out of the CARES Act. And in our last meeting, the CARES Committee did approve them. That is for computer purchases that the treasurer did and the recorder did when we were shut down back in March. The treasurers came out of the general fund, and then the recorders came out of her perpetuation fund. So we were looking to reimburse the recorder for her perpetuation fund, and then reimburse the county general out of the CARES money, for those. The recorder's cost was,
You have the
these two,
plans
right?
in your packet.
Yeah, the receipts for it in the packet. One of them's for $1,128, and the other one's for $1,183. And the difference in it was, one of them needed a different port switch, which costed a little bit more money, and that was for the recorder.
I'm in the wrong business. We're in the wrong business.
Freedom order.
You in business? Not really. So you need a motion for us for the reimbursement?
Yes.
So moved.
All in favor, say aye.
Aye.
Motion carries. Done?
I'm not, unless you guys got any questions for me.
No, be safe out there today. I know you'll be out checking the roads and all that.
Secondly, it should start about 4. Winds will pick up this afternoon.
How much snow accumulation?
National Weather Service is saying 6 to 10 total. BAM Weather is saying, up to 12. The winds get as high as they were expecting, and as light as the snow is, we'll have some whiteout conditions. And that
White out tonight.
this evening. So the travel home tonight will be pretty rough.
What about for later this week?
A little too early to tell, but the National Weather Service is tracking another strong system that's supposed to come in Wednesday night. The problem they're having with their radar right now is that as strong as this storm is, it's coming in, and the size of it, their radar cannot pick up the size of this second storm. But based off of the conference call yesterday, it's gonna bring, they're anticipating the same amount of snowfall as this one. So if we get 8, which they're expecting 8 to 9 total for Carroll County, we can probably expect another 8 by this weekend.
I'm writing that, Congressman.
Well, the wind's what's real.
And we are in an advisory right now. And if we do go, I'll be out, of course, throughout the night, and that we might go to a watch, but of course I'll text you guys before we go up to a watch.
I think you get a lot of response out of your Facebook page. A lot of people thank you for forwarding it.
It's actually increased a lot lately.
Yeah. It has, yeah. I'm like normally the second or third one to see it, and I forward it on, and I get a lot of response from it, and I appreciate that.
Thanks, sir.
Thank you.
We have clinic proposals now before us. And, yeah.
You have this, but I need to just, see some more answers as a conflict of interest, so just needs to be signed. That's all.
That's for, CNC Enterprises, Boone County property, since he's related to before we had.
Well, do we have a presentation from someone here for, let's see, it says Rotary Memorial Service?
I was looking for one.
Please come up.
All right,
Welcome.
thank you for having me. No, no, I'm able to do restriction conference, okay. Okay, that's great, I guess. Okay.
Not for me to read, for me to pass this out.
Yes, please. My name is Rachel Theodore, I'm the Vice President at Logansport Memorial. I oversee our physician network, our sports med program, our therapy services, and last but not least, our workforce health program, which is what I'm gonna talk to you about today. Within our workforce health program is everything we do for employers, including clinic-based care, occupational health, and workplace wellness. So on the right side of your packet, you have your formal proposal, which I'm gonna talk through real briefly in about 10 minutes. And on the left side, you have the providers that would be taking care of your employees, should you choose us. And behind that is a contract for clinic and wellness. And I did break that out so you could see the cost for both services. So our clinic-based care program, some reasons kind of why to do this, which I'm sure you already know. Better financial health for your organization. It actually causes your claims to go down, usually somewhat up to 70% sometimes. It also increases engagement in a wellness program if you do that both. We really like to do both for our employers because the wellness program feeds into primary care. So when we draw blood work on an annual basis for wellness, if we find any critical values, we can get you right in with both of these providers very quickly. This clinic is also a walk-in clinic, so you know, if we're doing blood work and we find a critical blood pressure, we can send you right over to see our providers. So that coordinated care is really important, and we are able to provide that with our all-encompassing workforce health program. We would be doing this at our Camden Health Center. It is open 5 days a week, Monday, Tuesday, Wednesday from 8:30 to 5, Thursday from 8:30 to 6, and Friday from 8:30 to noon. Linda Stapleton, our nurse practitioner, is there every single day, and like I said, she takes walk-in appointments or scheduled appointments. We have Dr. Anderson there. He's there on a monthly basis, and he does see patients by appointment only. When you're at the clinic, we provide a number of services, including disease management, pharmacy, lab testing, vaccinations, and acute care. We at Logansport Memorial have our own lab, and we have a courier every day that comes and picks up the labs from Camden and takes them to our main campus to be processed. That's in a very timely manner. Like I said, that happens every single day. And we also can do point of care COVID testing. I know that's probably a concern right now, but we do COVID testing, and these providers are very used to caring for COVID patients. I'm sure, as you heard, we got hit pretty hard in the spring, so we feel like we're pretty good at managing COVID now. We do have our full electronic medical record, as well as online scheduling and scheduling over the phone, whichever is most convenient for your employees. And we have full referrals to our broad care of specialists. So within what I'm presenting to you today, this would all include your primary care, your physicals, your acute care, you know, if they walk in and they're sick, they're not feeling well. If you need any specialized care, we can get you in sometimes same day, next day with orthopedic surgeons, general surgeons, urologists, dermatologists. And we have all those services on our main campus. And those referral networks are very, very clear and concise and can happen very quickly for your employees. We will also stock medications on site for your employees. So between pharma, lab, seeing a provider, everything's there. It's a one-stop shop for your employees, everything that they would need. The list of medications and labs that we would provide are in your packet here, so you can see what comes with the program. If a medication isn't on this list, but your employee needs it, we can absolutely request that for them. We can have it mailed directly to their home, or we can have it shipped and they can pick it up next day or in a couple days. So this is what we carry in our basic package, but if your employees need something else, we can absolutely add to this list.
So is that our prices for our employees?
Yep, those are your prices. Everything in here, so you see your labs first, which is on page 9. And the visit costs $75 when they walk in the door to be treated, and then anything else they would need, you would see the lab charges, the pharmacy charge, and then the vaccination charges are on page 14, and that's all in the contract as well. Within the wellness program, very comprehensive wellness program, which like I said, feeds right into your primary care. We do a full health screen right here on site. We come to your employees to make it as easy as possible for them to participate. It's kind of a mini physical in a sense, and we're really looking to pick up any critical values, anything that your employees might need further care for before it becomes a really huge issue. So we do blood work, we do a full lipid profile, cholesterol, LDL, HDL, triglycerides, we do blood glucose, A1C if needed, which is a 3-month measure. We do blood pressure, body comp, clinical height and weight, your resting heart rate, and we will do nicotine screens too if that's something you wanted to work into your program. We would do the face-to-face biannual health coaching twice per year. We do goal testing twice per year. So at that first health screen, if we find that your cholesterol is a little bit high, we test it again in 6 months for you to make sure that what you're doing is working. We also do one-on-one healthy living packets. So when we come, we bring kind of a little healthy goodie bag, we call it. And then, like I said, we'd be able to really refer any employees directly to get further care if they needed to. So it's a really comprehensive network for your employees between wellness, acute care, primary care, and then any physicals they might need.
We already have that on our wellness program, we do that already.
Do what?
The,
The blood, the finger stick and all that?
right, for them to get their health ratings, they already doing that for us.
We don't do that. I think you have another company that does that.
It's not them.
Yeah.
Actually, in 2020, we decided to go with, our broker had set up an outside vendor to do it, but then because of COVID, we didn't get enough to see those preventative for 20. I'm working on getting the finger stick scheduled now for March.
Our biggest concern is just making sure that we would have access to that data, because if there's any critical values in that, we need to make sure that gets addressed. So that's why I wanted to include wellness in my proposal, but if you don't choose to do it with us, that's no problem. We just wanna make sure we have access to the data.
That is available, I'm sure.
Okay, okay. So just in summary, some of the qualifications of our staffing. Like I said, at the clinic, you'd have a full-time nurse practitioner, you'd have a part-time physician who oversees. Dr. Anderson is our hospitalist at the hospital, so he's been taking care of a lot of our sickest patients. He's a phenomenal physician. You can actually Google search him right now. He does a whole talk on COVID, how to manage COVID, the vaccine. He's just a phenomenal physician. And he oversees the Camden Clinic. And then we do have front office, a medical assistant there. And then our wellness staff includes a dietitian, an exercise specialist, a nurse, and a respiratory therapist. So we feel like we have everything in place to really take care of your employees as best as they need to. And also to kind of summarize the cost, it is $75 per visit when they come to the clinic. Your labs, medications, and vaccinations would be billed on utilization based on the appendices that I included in your proposal. Any other services would be at a 30% discount for you. So say they're at the clinic and they request another service, a vaccine that's maybe not on this list, we would discount that for you at 30%. And the wellness services are $14 per person per month. But again, they're two completely separate services, but I did want to include a proposal for wellness in case you were interested in that as well.
What did we pay for them to go to,
I'm
the clinic?
gonna have to look it up, but it's right around 75 to 90.
What we have now until March?
It's between 75 and 90, I think we'll pull it real quick, so.
No, you're good.
And if we need to adjust that at all based on what the services we're providing to get a little closer to what you're paying now, that's definitely a discussion we're willing to have.
I don't think you're higher,
Okay,
No, but
I think you're right at,
okay, okay.
what is your monthly service fees for us? To have your, cause that's what I think we would run them into, you're saying. So if nobody used the clinic that month, we still pay.
Nope, we charge you based on utilization. So you pay $75 per visit, and then all of the additional vaccinations, labs, meds, that is paid based on utilization.
So you're not gonna charge me light bulbs in the parking lot?
I am not gonna charge you that. I know Camden is a little bit of a drive for some of your employees, so that's probably the only catch.
is more center of the county.
Hmm,
It is more center of the county than
Okay.
anywhere else.
okay.
Well, see, the
They'll
issue,
they'll find any place where the other people have it.
Mhm.
We don't pay, and now we only pay as we go.
pay them.
Yeah, we don't pay any service
Okay.
fees or anything like that. We used to, but
Right.
last year it got changed to the pay.
Okay.
And that's probably why they don't want to deal with it, because they want people free money.
I would provide you as well with quarterly reports, so you could see the utilization of the clinic. For wellness, we provide yearly reports. Every time we do a health screen, you would see the data that goes along with that health screen, obviously in an aggregate manner, not everything's completely de-identified. But you would at least see the utilization, so you would know what was going on and if your employees were utilizing the clinic.
Now, on they have to do this Wellsman check to get their health savings account.
Mhm.
Would you be willing to come on site to do that?
Absolutely. We always come on site and make it as easy as possible for your employees, and we'll go to multiple locations if you'd like us to do that as well.
Right now, the way our wellness is, we go with a separate vendor.
Right.
I'd have to compare, you said 14 a month
Per person.
per person. Even if they just did, like, if we just wanted to do finger sticks, it would still be 14 per month and
I
not
would-
per.
I would drop the price, and I can get back to you on that. In this program, I had us coming on site twice per year, that, at that 6-month mark, we would do a check on whatever goal, whether they chose blood pressure, cholesterol, A1C to lower. If we wanna remove that, it would probably cut your price quite a bit, probably closer to 9 or 10, but I'd have to run the numbers.
That's like when we used to have you come out.
Mhm. Mhm.
Right.
Yep, and I think we came 4 times per year at that point,
Yes.
so I dropped it to twice per year.
That's all we require now, anyway, to get the health savings.
We did, well, we only did the finger stick once and then we did the 2 preventatives. So it can be a vaccination, it can be a physical, colonoscopy, it can be anything that's considered a preventative.
And we can set those appointments up for them at their health screening too, to make it real easy for them. If that's something that you were interested in.
Would it be easier on the billing just to have one company to deal with, than a couple separate?
I can't really answer that since we didn't use the vendor last year.
Yes, we
Oh.
didn't use it now.
So.
Did they still charge us even though we didn't use it? No?
Cause they just charge when they come.
Okay.
My memory's not that great. I feel like it was $8 per person, but it was just the one time, you know, when it came. I feel like it wasn't a monthly charge.
Yeah, I think it was.
Um,
It was cheaper than what, than going with it,
Oh, yeah.
so.
But if I recall right, we have money left over, so I wanna help our employees as much as we can,
Right.
get them the best care they can.
Is there anyone, you have some employees and staff and department heads out there, are there any of you have questions you'd like to ask of them?
I will say, I was looking at the American West and certain things, and they're right on with you. If you don't use the program like at Walmart or whatever, they're right on.
And also with that, too,
They're good prices.
$75 a visit. Ted, did you look at this contract?
Right. I read the clinic agreement, yes, and it's a 1-year contract, automatically renewable, 60-day notice of termination with or without cause, so you're not locked in, you can get out of it as long as you give the 60 days notice, and there's a termination for cause that can be terminated immediately, both by the clinic and by the county, and everything looks in order.
It's good to me. I'd like to have.
I'll just try and answer your question. I know some of them used it over in Florida and some of them didn't, just because they didn't care for the facility. And you're gonna have the same thing here. I know we can't make 100% people happy, but at least we can try to save them some money in their pocket.
Workouts available to them.
All right, Lauren's not here, so she's gonna go try to call and see if there's a problem
honestly review it, I like to go through it again.
Right, but I meant, we're like gonna be 15 minutes ahead of schedule, so if we can move on, and then she could try. Thank you.
Thank you, is it
Thank you,
okay if
Rachel.
I have to get back, cause we have emergency operations planning with the weather?
Yeah.
Any other questions for me right now?
Nope, you're good.
Okay, thank
Get
you.
with you, thank you.
Thank you very
Thank you
much.
very much. So we're on, Robert? Yeah. Okay, well, then I have something I want to interject here and bring up, and that's something that we've talked about now for several meetings, and that is the opening of the courthouse here, the doors down there. I think that with these temperatures out here of 10 degrees, 11 degrees, it was 10 when I left home, and, going up to 11 by the time I parked out here in front. We should not be keeping a door locked and having people stand outside and waiting. I've also had several phone calls from people who were upset about the situation. And, one gentleman told me that he stood out there and called every number on the list and not one of them answered. So, that's kind of a tough situation. But,
Shaking their head.
They're
all shaking their head.
I'm gonna shake my head because we answer every phone
Yeah.
call. If we get something on our voicemail, we return it within an hour or so.
the only thing that made me think that he was quite right is I stood out there one day and called Fuller for it, one answer.
I don't wanna pinpoint, but if you're talking, it could be the upstairs because they are,
Horribly understaffed.
well, and they're also in court or they're, they're lined up. I mean,
There's
I had
one.
someone that when I got mail, they were here an hour early. They are not going to let somebody in here an hour early. So I just told him to go back to his car. I also have let some people stand there while I'm waiting on my person. I mean, we're not mean to them.
Well, I know with the caseload going on upstairs, that they're running the third floor downstairs at least 20-25 times a day to let people in. I'm in favor of opening the courthouse, but I still want them to wear their mask while they're in the courthouse. I'm not a mask fan, I'd say, but out of the respect of our employees, I think we need, at least in their offices.
I think it makes some of our employees feel more comfortable. What's your opinion on it?
Well, I think, of course, the courthouse, whether, of course, mask goes, you can post them, but to me, I think it's an individual has to, like, make that decision. I want to protect the employees, but when we have they can be called from, upstairs here, to come up. Yeah, you could be a limit for that, or it shouldn't come up. As far as the mask goes, I think, I got a personal opinion on masks, so I'm gonna stick with that. If we do provide with shields and that sort of thing, so. Anybody can wear a mask, they want to.
Well, I talked to Dr. Dutter, and he said the 6 foot apart rule is a very good rule, and it helps an awful lot. And he said the shields that we put up in every office should be sufficient.